This morning while I was driving into work, I was listening to a radio announcer talking about Zoloft. And what was interesting was how this disc jockey was reporting on how Zoloft treatment, of course, is for depression, anxiety, suicidal ideation. In some cases, actually, can help people with insomnia. But then in his next breath, he reported how the side effects of Zoloft can also be depression, anxiety, suicidal thinking, and insomnia. I think it's an interesting point. Zoloft is a powerful drug. It helps a lot of people. But there's some people who do get serious side effects from it, very serious. And the question from a sleep angle that's been very interesting to us for quite some time is just how would Zoloft produce some of these symptoms? And of course, there's probably several mechanisms, but one of them is clearly going to be a sleep-related function. For example, did you know that when a person goes on an antidepressant medication in general, and we see this in Zoloft a great deal, brainwave activity is actually speeded up during the night. So your sleep is actually changed by the use of these medications. As you may know, the way Zoloft and other antidepressants work is by extending the time it takes for the body to get into rapid eye movement sleep. That's a marker. It's a biological marker that the antidepressant is likely to be working. So Zoloft speeds up brain waves, delays the onset of REM sleep, and further, it actually causes a sleep disturbance known as restless legs or leg jerks in some people. Now, we're not sure yet whether it actually causes that problem or it just worsens it in people who are already susceptible to having restless legs and leg jerks. So in our world of sleep medicine, with our particular perspective, we wonder whether or not Zoloft is actually causing a sleep disturbance in a number of people where they get side effects, because once you increase the speed of the brain waves during the night, add in restless legs and leg jerks, or do other things to impact the quality of your sleep, for example, not getting enough REM sleep, is it possible that those particular changes would lead to some of these symptoms of depression, anxiety, suicidal thinking, and of course insomnia? And I think the answer to that, while it's speculative to say so now, it's still something that is a reasonable hypothesis as to how these drugs could make somebody's condition worse by worsening their sleep. So I think that's very important to consider, because there's a number of people in the use of antidepressant medications often discover that one medication, the first one they use, doesn't work. They often have to be tried on a second medication, many times in certain cases a third or a fourth medication. Our interest in this area is whether or not the medications that are being selected are worsening the patient's sleep problems, and that's actually what's causing some of these side effects. If so, it would be very important then to find the right antidepressant medication that had the minimal effect on one's sleep, and therefore less likely not only to not cause those side effects, to actually produce the good treatment effects that you're looking for here by decreasing depression, anxiety, suicidal thinking, and insomnia.